This short video should provide you with some quick tips to help you feel comfortable and prepared for newborn resuscitation. This photo provides you with an equipment list for initial resuscitation needs. It is not an exhaustive list, rather the most important tools you should have at bedside. This is the rear of the Panda warmer. Per departmental protocol, this switch should always stay in the on position as shown. Ensure that the oxygen and air wires are plugged into the wall source, which is generally found in the area directly behind the warmer. Tanks are present on the warmer, but are only to be used for backup or transportation. Start by turning on the Panda warmer using this button. It takes a few seconds to turn on, so prepare in advance. Once the machine is turned on, press Admit Baby. This will allow you to see other functions and processes for the warmer. The warmer will initially start at 100%. Use these buttons to change the heat source intensity. You will feel the heat source if it is on. Place the temperature probe on the baby and change to baby mode. Set the temperature to 37 C to keep the baby warm. This is how you start pulse ox monitoring. Make sure the pulse ox probe is on the baby's right hand. A baby may not reach 90 to 100% oxygenation until 8 minutes of life. This button can be used as a timer or for the APGAR score. This knob adjusts the light, not the temperature. This switch will turn on the suction device, which is connected to the suction canister, which is on the right of the Panda warmer. This switch will turn on the oxygen supply. This is the PIP knob. PIP should be preset to 25. Two blenders are provided. One is for the T-piece, which is to your right, and the other is for a secondary oxygen source, including bag valve mask if needed. Initial flow should always be set to 10 liters per minute. Oxygen percentage varies according to gestational age. Oxygen should be started at 21% for infants greater than 35 weeks gestational age, and 30% for less than 32 weeks of age. It should always be 100% if performing CPR. This demonstrates how to appropriately test and adjust the mask and T-piece for adequate PEEP and PIP before applying the mask onto the baby. These starting parameters are crucial to prevent barotrauma in the newborn. To start, create a seal using the mask and your hand as shown. This will demonstrate the PEEP. It should move as shown on the gauge or manometer above. The appropriate starting PEEP is 5, and the appropriate PIP is 25. Provide a breath to the newborn by pressing on the top of the valve, approximately 1 breath every 2 to 3 seconds. You can change the PIP directly on the warmer. And the PEEP on the T-piece itself using the small knob as shown. Though this video demonstrates how to use the Panda warmer, it does not go into detail regarding the NRP algorithm. For more information about the algorithm and medication dosages, you can visit www.nrp.com or refer to the posters next to the Panda warmer. We hope this video was helpful in providing you with some quick tips and make you a little more comfortable during your next resuscitation.